Hello and welcome to the Concentra webinar, What You Need to Know About Injury Care. Today's webinar will be presented by Jim Waugh, Physical Therapist and Director of Physical Therapy Operations at Concentra, and Dr. Deepa Rajakrishnan, Physician and Director of Medical Operations at Concentra. Both Jim and Dr. Deepa have extensive experience in occupational medicine and work injury care. At the conclusion of the presentation, we will have a 10 to 15-minute Q&A session with Jim and Dr. Deepa. They will answer as many questions as possible within the time allowed. The slides and a recording of the webinar will be emailed to you after the presentation, so you can view them again at your convenience. Jim, Dr. Deepa, we're ready to begin.
Well, thank you. Hello, everybody. Good afternoon. So the first slide is just sort of an introductory slide. So in this webinar, we are going to be discussing about work injuries. We'll also discuss about how much of an impact work injuries are to you and to the community. The key to remember is that injuries at work are most definitely preventable, but not totally avoidable. Jim?
So our agenda for today, we're going to cover what makes work injuries different, the importance of having an injury care plan, and why you should work with an occupational health care provider. Dr. Deepa?
So, yeah, I'm coming. Not only can these injuries put employees at risk, it also can reduce productivity, affect the company morale, increase workers' compensation claims, and impact your insurance rates. Moreover, work injuries are more preventable with proper training and awareness. Next slide. According to the OSHA standard 1904.5, an injury is defined as a work-related only if an event or an exposure in the work environment either caused or contributed to the injury or significantly aggravated a pre-existing injury or illness. The general rule is an injury or an illness is presumed to be work-related when they occur because of events in the workplace. Whether or not injuries and illness are caused by something in the work environment is key to determining if an injury is work-related. It's critical that you know what OSHA considers the work environment to be to avoid record-keeping mistakes. OSHA defines the work environment as the establishment and other locations where one or more employees are working or are present as a condition of their employment. The work environment includes not only physical locations, but also the equipment or materials used by the employee during the course of his or her work. So if you're in an industry that relies on keeping recordables down, how a work injury impacts your business may be different from an industry that does not have to think about recordables. Too many recordables can have a negative effect on your bottom line. Having an injury care plan can change how much of an injury impacts your business because it's the difference between being prepared or not. So knowing your process and who needs to do what and when can streamline the whole process so that the employee gets back to work faster and minimizes the impact to your business. The more severe an injury is, the more it can impact your business. For example, an employee with a broken back may be out of work longer than an employee who's just sprained their wrist, for example, even though a minor injury can also have significant costs. Next slide, please. Jim.
Yeah, the slide, are you advancing? There we go. Perfect. Go one more slide. Perfect. So work injuries include two types of costs, direct costs and indirect costs. The direct costs are what you pay, such as cost claims, medical costs, etc., which are also the same costs that you would be paying for a personal injury. In addition to direct costs, work injuries have an indirect or indemnity cost. These include an employee's time away from work, temporary labor costs, training costs, and much more. Next slide. The evidence that indirect costs have a large impact on work injuries is overwhelming. According to the Occupational Safety and Health Administration, a single sprain incurred at work can result in approximately $30,000 in direct costs and almost $33,000 in indirect costs. How much of the direct costs you pay depends on your workers' compensation insurance policy, but you will always be responsible for the indirect costs. An injured worker's time away from work means a lot of lost productivity. This can impact your business both in the short and long term. Next slide, please. The impact of indirect costs can be greatly influenced by a number of factors, either positively or negatively. These factors include the injured worker's direct supervisor, their coworkers, family and friends, TV, internet, and billboard advertising, HR or safety manager, time away from work, the medical provider, the physical therapist, specialist provider, adjuster, nurse case manager, and or the lawyer. However, negative influences can be mitigated if you have a good relationship with your occupational health care provider, resulting in the best patient outcomes and lower cost per claim.
So next slide. Having an injury care plan in place helps to facilitate the return to work process without delay and returning your injured employees back to work as soon as possible. That is best for the employee and the company. The injured employee can also recover faster and resume normal work and life functions sooner. After an injury takes place, it's easier to act if you already have a plan in place. Immediately following an injury, managers, supervisors, and employees should all know where to go, who to contact, and what to do. Next slide, please. So the key is you may not be able to avoid every workplace injury, but you can prepare to take action by developing an injury care plan. Why is this important? So according to data, every day more than 12 workers die on the job, about 4,500 a year. And every year, more than 4.1 million workers suffer a serious job-related injury or illness. An enhanced focus on prevention is needed to bring these numbers down. Next slide, please. Again, you may not be able to avoid every workplace injury, but you can be prepared to take action when an injury does occur by developing an injury care plan. Working with an occupational health provider, you can be confident that your employees will receive exceptional care delivered by a team of occupational health care specialists. So these are some of the steps how to get started. First, identify a work injury care provider. Then develop a plan that details what employees do if they are injured at work. What should they do if they are injured at work? The next step is to prepare your team by identifying who is responsible for documenting the injury and authorizing the treatment. Tour the selected medical center to see where your employees will get care. Ask if a clinician can visit your workplace. Then share your injury care plan with your employees. It's very important that they are aware of what the next steps should be. And then carry on. You'll know, you'll be ready when an injury occurs. So touring the selected medical center to where your employees will get care is pretty critical. Next slide, please. We'll cover more of what to look for in a work injury care provider in a few minutes. But for now, here are the 5 things you should require in any injury care provider or clinician you work with. It should be easy for the employees to get to. The harder it is for the employees to get care, the more likely they're not to finish their treatment plan. So the provider you choose to work with should be easy for them to get to, whether that means being located close to your workplace or offering transportation to employees. Next, be in network with your insurance carrier. This one goes without saying. If your provider isn't in the network, you will be paying more out of pocket. Then make sure that provide all services you need under one roof. This ties back to the convenience aspect we talked about at first. Having all the services an employee needs to get better, whether that's injury care, physical therapy, specialty care, or something else in one place makes it easier for them to complete their treatment plans. And this also results in better outcomes for you. Be an expert in workers' compensation and federal state regulations. This is a must. If the clinician does not know workers' compensation and the federal state regulations, they won't be able to deliver the best outcomes. For example, a physician who does not know OSHA regulations may provide great care, but may mark an injury as recordable when it could be marked as first aid. And then the focus on return to work. Again, a clinician who is not an expert in occupational health may provide great care, but they don't always consider the return to work and also the injury's impact on the employer. Jim?
Next slide, please. So in addition to finding an occupational healthcare provider, you need to identify which of your team members will be responsible for documenting the injury and authorizing that treatment. Next slide. It's always best to create a plan that details what employees should do after a work injury. Knowing what everyone should do and when they should do it is essential. Who is involved in that plan can depend on the size of your company, your insurance carrier, and your state's workers' compensation regulations. At minimum, you should identify roles and responsibilities for your employees. The slide you're viewing now is an example of a basic injury care plan. You can use this checklist to get started on creating your own. We will also provide the resources, a picture of this slide, as well as the whole presentation after this call, so that you can then use this to start your own injury care plan. Next slide. It's also important that you share your plan with your employees to show them that you care. A work-related injury can be troubling, especially if the employee stands to lose time from work. Making sure your employees know what to do after an injury not only provides them with a clear process to follow, but it also reassures them that you will do everything you can to support them at every step of the way. The investment that you make today will help ensure your employees are well prepared, avoid treatment delays, and lead to better overall outcomes. Best practices for sharing your plan is to have a team meeting so you can proactively address any questions or concerns that they may have. Next slide. So when partnering with your occupational healthcare provider, it's a good idea to tour their facility, as we mentioned earlier. Touring the medical facility not only shows you where your employees will get their care, but it also gives you the opportunity to meet the medical staff, which is a key to your partnership.
Next slide, please. Why do you need an occupational health provider? Qualified occupational healthcare professionals can assist the employer, that's you, in achieving a safe and healthful work environment. Along with other safety and healthcare professionals work collaboratively with labor and management to, one, identify potential hazards and to find ways to prevent, eliminate, minimize, or reduce hazards. They also help to develop and manage training programs to promote workplace health and safety. They provide screening to specific chemicals or exposures, including pre-placement, that is post-offer physical examinations, job placement assessments, periodic examinations, and maintenance of confidential employee health records, including individual screening results. They also help to manage and/or treat work-related illnesses and injuries, with emphasis on early recognition and intervention. They can also make recommendations about work restrictions or removal, and follow up and monitor workers as they return to work. They also help and develop health promotion programs and provide guidance for case management of employees who have prolonged or complex illness and injuries. Next slide, please. So when a work injury occurs at the workplace, so we've seen research which shows that returning an injured employee to work and normal activities as quickly as possible impacts the physical and emotional recovery of the injured employee. So this would mean considering the injured employee as an athlete, almost like an industrial athlete, and that helps to understand how the return to full functionality is critical. To help them regain the function, not just resolving pain, it is important to balance movement, rest, medications, and other adjunctive treatment. Continued improvement of functions will give the injured employee the confidence which will further impact not only their physical, but also their emotional recovery. There are several studies which show how early intervention helps, not only to help the injured worker recover faster, but also helps to cut down cost. Next slide, please. So what's different about occupational health and regular non-occupational clinicians? So even though both They provide great care. Occupational health clinicians apply worker compensation expertise. They practice early return to work. They focus on the return to work and also know and understand OSHA regulations, including recordable regulations. So some primary care or other non-occupational health care clinicians may have some experience with workers' compensation and OSHA regulations, but they may not be as knowledgeable in them as occupational health clinicians. Jim?
Thank you, Dr. Deepa. So why should you partner with an occupational healthcare provider? There's several reasons. The first one would be occupational healthcare clinicians provide great care and are focused on helping patients recover safely and quickly. Second is every state has different workers' compensation regulations, and occupational healthcare clinicians stay up to date on those regulations to help you get quality outcomes. Occupational healthcare clinicians are trained in best practices in managing the process of return to work and what is and what is not a recordable injury. And finally, occupational health carriers stay updated on all federal and state regulations so they can deliver the best care possible to your injured workers. Next slide, please. So why would you want to choose Concentra? Well, a lot of the things that we covered earlier in the presentation as reasons that you would look for a good occupational healthcare provider are exactly what we can offer. We offer complimentary transportation for all initial work injuries. We are in network with all major workers' compensation insurance carriers. We stay up to date on state and federal regulations and require that our clinicians have regular training. We have over 40 years of proven return to work outcomes. Your employees can receive all the services they need in a single location. And we have an online reporting system to keep you informed on the progress of your employee's injury at each and every visit. Next slide, please. So as you can see from this picture of the map, Concentra has a very large footprint. We operate over 650 clinics and on-sites in 43 states. We are a nationally recognized expert in work injury care and occupational health, and we offer a full range of services including work injury care, occupational medicine, urgent care, physical therapy, drug tests, DOT, physicals, preventative care, and much more. And that concludes our presentation for today, and we will be opening it up for questions.